Wonderful. So good afternoon and good morning to those joining us out west. Welcome to today's Let's Talk NMD webinar, Parenting with a Physical Disability, Rolling Over Challenges. We're really excited for this webinar. This was recommended to us by one of our medical, scientific, and advisory committee members. It is an important topic. At MDC, we not only cover or represent individuals with neuromuscular conditions, but also family members as well. And we know that the family unit is an important part of the neuromuscular community. Really grateful to have two speakers that can speak well to this topic. Marjorie Aunos is a single mother by choice living with a spinal cord injury. She's a renowned psychologist and researcher in the field of parenting with disabilities, an award-winning inspirational speaker, and the author of Mom on Wheels, The Power of Purpose as a Parent with Paraplegia. We're also here today with Evelina Pituch. She is a postdoctoral fellow at the University of Toronto Scarborough. Her program of research aims to improve the perinatal and parenting supports for parents with disabilities. She holds a Ph.D. in rehabilitation sciences and a bachelor's professional master's in occupational therapy from the University of Montreal. So I can pass it over to both of you. And if you have any questions or comments, please enter them into the chat or the Q&A, and we'll address them at the end. Thank you.
Thank you so much, Hamira. Welcome, everyone. Thank you for joining in today for today's webinar. And for those of you who will be listening to the recording, thank you very much for your attention. Really happy to be giving this webinar today with Marjorie. Thank you to Hamira and Alia for the invitation and organization. That's really very appreciated. Although this webinar will be in English, Marjorie and I are French speaking, so we'll be happy to take any questions or thoughts you may have at the end of the webinar in French as well, and we'll be happy to do any translation if that's helpful as well. So today's webinar is titled Parenting with a Physical Disability, Rolling Over Challenges. It is well known that some parents living with a disability may come across some challenges in their parenting role, but hopefully today's presentation will cover also some of the solutions and resources that are available to parents living with a physical disability. And of course, if you have yourself any insights, solutions or suggestions, we'll be happy to hear those at the end of the webinar as well. Okay, so moving on, just making sure that we have no conflicts of interest to declare, both Marjorie and I, at the forefront of this presentation. And as a reminder, today's webinar focuses on three broad questions. The first question that we hope we'll answer is, what is the current state of research on parenting with a physical disability in Canada? The second question is, what are the recent findings from a Quebec study that both Marjorie and I conducted? And we'll share some insights and details in just about a few slides. And the third and last question would be, what resources are available to support parents living with a neuromuscular disorders? Maybe some of you are joining in on today's webinar as well, or you have family members and you have some questions. So please feel free to add those in the chat as well. So just to put in context, to our knowledge, one of the first actually researchers that was herself a mother with FSHD, so one type of neuromuscular disorder, she conducted some research in Canada about 20 years ago. Here you have some screenshots of some publications she authored, and which still to date have been very much read and shared throughout the research world. So those were authored by Ora Preleltensky. And these are, to our knowledge, actually one of the first accounts of research and parenting research with a disability in Canada. And more recently, across the border in the United States, we also have Robin Powell, who is an attorney and also a person with lived experience of disability. She has arthrogryposis. She's also an associate professor at the University of Oklahoma College of Law and a researcher at the Lurie Institute at Brandeis University in the States. And she has published over a decade actually on the topic of parenting with disability, disability rights, and as well disability reproductive justice. So if you're interested in those topics, we really recommend that you read her publications. And one actually seminal report that she authored for the National Council on Disability is entitled Rocking the Cradle, Ensuring the Rights of Parents with Disabilities and Their Children. And maybe just to introduce to the topic of our webinar, we wanted to share a short video clip. So hopefully that will work fine. Just give me a few seconds here. And Marjorie or Hamira, if you can confirm that the sound is sharing, well, that would be great.
Right now, we're not seeing anything on my end. We did try it before.
We did actually. Okay, just give me a minute. I'll try again. Hopefully this time it'll work.
Yes, we can see.
Excellent. That's the first step. And now how about sound?
Was never asked, oh, when are you
The
gonna have
sound is
children,
here.
or when are you
So
gonna
we're
get
good.
married? And we have this view of independent living, which I think is a problem even in the disability community. And independent living means you've graduated high school, you've gotten your own apartment, maybe you've gone to work, but no one asked the next steps. Do you plan to have a family someday? Are you having a relationship? Do you plan? We never ask those other parts, which are deemed so normal in everyday life, but they're not normal in the disability world. When women go in for their annual exams, they may not even get an annual exam. Doctors may presume that they don't need one based on this assumption that women with disabilities aren't sexual beings. You know, personally, that happens to me all the time. People with disabilities have sex, contrary to popular belief, which is okay. I've had multiple offers of hysterectomy. Like they were doing me a favor. Multiple doctors have asked me over the last 15 years, oh, would you just like to have a hysterectomy? And I'm like, well, you know, that sounds lovely not having my period, but what happens the day I decide I want to become a mother? Then I think I'm going to need that uterus back. So doctors don't really know that, and I think they don't understand. They can't even foresee that, and I've had to pick up multiple jaws off the floor, so to speak, because they look at me like I have had 10 heads when I've mentioned that I intend to become a mother someday.
So hopefully now you can see again our presentation. This video clip was really just, we were hoping just to kind of start having this conversation about parenting with a disability and what it represents in the disabled community as well. So happy to have your thoughts at the end of the presentation, of course. And in the spirit of the International Women's Day, which is actually tomorrow, we also wanted not only to highlight the research work of researchers such as Ora or Robin Powell, but also many accounts of women with disabilities that also happen to be mothers. Some of them are authors, musicians, advocates, and we have a few actually examples of those on the screen where they actually wrote their stories in blogs or newspapers and so forth. So there's more and more accounts of mothers with disability and parents with disability assuming their parenting role satisfactorily and safely. And with that, I will pass it on to Marjorie to continue with the introduction.
Thank you, Evelina. So the literature in parenting with a disability is growing, but still limited, like Evelina mentioned, especially when we compare it to other fields of study. We have now about 5 decades of research concerning parents who have an intellectual disability. But in the last 20 years, very few research have focused on parents with a physical disability. In Canada, though, we are quite lucky. I consider ourselves very lucky because we've had active research groups, especially in Ontario, one that actually Evelina works with now, led by Hilary Brown, that uses sort of population-based data sets to gather information and data to be able to use to justify gaps in services and the need, because there is a growing population of parents who have physical disabilities. We also have had, in the last 5 to 10 years, several theses from PhD students, including Evelina, and it's part of her thesis that we will be focusing on today, who also have brought forward some elements of lived experiences, some elements of different groups that navigate and work with parents with disabilities in identifying against sort of those gaps and what are those needs in terms of services. But the reality of it all is that we have really, throughout the last few decades, really focused on finding ways to increase the quality of life of children who have physical disability, to empower them in their roles or their future roles that they could take. But a little bit like Robin Powell was mentioning, when they get to adulthood, it's like services do not take into consideration some of the most valued role that we have in society, which is family and becoming a parent. So it doesn't translate into age-appropriate changes in services. It's very rare that we have family planning services, for example, that are offered to anyone who has a physical or intellectual disability, as a matter of fact. You can change that to the next slide. There are several studies that have touched upon a subgroup of a population of physical disability that looks at neuromuscular conditions. And so I wanted to bring that forward with this slides. And basically what comes out is, one, the perspective of disabled parents that basically say, look, we're capable of doing this. Our lives may be different, but it's not significantly different. We still have the same fears and desires of being like a good parent, but we might have a little twist that's related to our physical condition. So for example, it might be, I want to make sure that my son is, developing and sort of being able to play outside in his environment, but I need to make sure that he's safe because I use a wheelchair, because I can't, run after him. So how could I do that? So that's the little twist, but the fear behind it, or the desire behind it, is very similar to all parents. They also mentioned that the use of genetic counseling should be a choice and not something that is automatically sort of imposed, which for some of the research participants from these research have been sort of almost imposed on. So you're not offered family planning, but as soon as they find out that you're pregnant, they sort of like look at genetic counseling. They did talk about sort of the impact that selective termination, or like policies that are around selective termination, can have in terms of their own self-esteem, sort of saying, well, what does that mean? That if we do this, then people like me or children like me would not be born anymore. And so they struggle with that notion. And what we find at the intersection of parenting and disability is really sort of the fear and the guilt for some. Some will mention like, will I be a good enough parent, or will I be normal enough? And all of those fears really stem from preconceived notion linked to ableism and sort of what we imagine appropriate or good enough parenting should look like. But also what they see is that their disability could actually be a benefit, that there are some lessons to be learned from someone who faces adversity and is able to overcome and deal with those adversities. An example that I often use in my personal life, I also had that fear, thinking that my son would probably be resentful because I couldn't run after him or go to the park the same way as his friends did. But he's now grown to be very creative, justice-driven young man. And so my disability has led him to conceptualize ways to create tools with his 3-dimensional printer. And that is his way to sort of deal and learn to deal with his circumstances and mine as well. The real issues that parents with disabilities mention is the lack of representation. So they don't know who to look for as models, and also the lack of accessibility of parks, pools, libraries, all of those common areas that parenting, or that parents and children, that families sort of go to, often are not accessible fully for anyone who might have a disability. And then the other real issue is that, yes, there are some challenges that they have to negotiate with in regards to or associated with their disabled body, namely in part fatigue or stamina that often sort of prevents us to do longer days that other parents might be capable of doing. You can change the other side, please. We do have a little bit of statistics that we want to share with you, and this is what we have. So in Canada, approximately 17% of reproductive age women have a disability. You can click. And pregnancy rates is actually pretty similar for women who have a disability to women who don't have a disability. And as a matter of fact, there is to 8 women who are pregnant, there is 1 that has a disability. And that number we have thanks to the group led by Dr. Hilary Brown.
So thank you, Marjorie, for that introduction. And just to kind of summarize what we know about research on parenting with a physical disability, and especially in Canada. So we're grateful that the team of Dr. Anne Burndall in Ontario and colleagues have established new Canadian guidelines on the labor, delivery, and postpartum care for people with physical disabilities. And that includes, of course, people with NMDs. However, as you just stated, Marjorie, to date, to our knowledge, most of research focused primarily on the period of pregnancy. We have overall little research on the period of early parenting. So for example, during those preschool years of children. And when we look closer within those studies, only a handful included parents with NMDs. And we thought that this should actually change, and which is why we conducted a study that we would love to share you some few details today. So our research team, you can see all the team members on the screen here come from different groups, research group, clinical groups based in the province of Quebec. So we had a team composed of clinicians, namely doctors, occupational therapists, researchers. We also had community partners, and a research assistant that assisted with the research work that we will present today. If you're interested to have any more details about our research, hopefully this will be published soon in the form of a report, but also a scientific paper, so stay tuned. And this work was made possible due to funding that we obtained through the REPAR, which is one of the thematic networks that we have in the province of Quebec in rehabilitation, and also the Office des personnes handicapées du Québec, which promotes living of people with disabilities and fulfilling living. And of course, as Marjorie stated, so this work was made possible during my PhD at the University of Montreal in the Rehabilitation Studies program, and I benefited from a number of scholarships, so I'm really grateful for that. And this work was supervised by Dr. Carolina Bottari, which is a full professor in occupational therapy at the University of Montreal. So we are now stepping in the second question of today's webinar. What are the recent findings from a Quebec study? So this is the study that Marjorie and I conducted. So we have actually three aims in exploring. First of all, we wanted to explore what was the 0 to 5-year-old parenting needs of parents with neurological impairments. Our second broad aim was to explore what were the services and resources available for those parents. And finally, explore the potential solutions to optimize parenting services for that population. Back to you, Marjorie.
Yes, in order to do that, we conducted focus groups with 5 different groups of participants and additional interviews, individual interviews. The 5 groups, this is really an added benefit of this study because usually we have 1 group represented per study. In this one, Evelina and Carolina really looked at making sure that we have a representation that's global. And so we conducted focus groups with parents who have themselves a physical disability, with clinicians that work in a rehabilitation center, community partners who may or may not, or most of them actually worked with parents with physical disabilities, spouses and partners of parents with physical disabilities, and also a group of researchers that work in this field. If we look closely in terms of the parents group, there were 8 parents, and on average, they were about 35 years old. There was 6 mothers and 2 fathers, which is often something that we like to mention, as there are way much more studies that look at motherhood and not fatherhood, which should be looked at in the future in terms of research. Most had children who were 2 years old. Most had more than 2 children and were in a relationship and had custody of their children. Half of them had an NMD.
So as Marjorie shared, we conducted a qualitative study, so which means that we actually recorded all those exchanges we had in conversations during the focus groups, which each of the stakeholders, and during the interviews as well. All of the interviews were then fully transcribed, and then we conducted what we called a qualitative analysis, thematic analysis, to kind of see, well, what were the overall themes or categories that we were able to derive from the data that we collected. So we had about a dozen of hours of material to analyze. And here on this slide, this is kind of the overview of the 5 main themes that came out from what participants shared within those focus groups and interviews. And we will go into detail into those 5 themes. So the first theme that we want to draw your attention, we called it social recognition and public awareness. And you'll see in the upcoming slides, kind of to illustrate all of those 5 themes, we also selected a key citation from one of the 35 participants that kind of really showcased the spirit of that theme. So for example, here we have a community partner that shared, we need to normalize disability in society. We need to talk about disability. We have to demonstrate that people with disabilities are there, that they exist, that they evolve. Talk about their sexuality, talk about the fact that they can be parents, all of that. So here actually participants shared that they felt a lack of social recognition of parenting with a disability or of themselves. They don't necessarily recognize themselves when we represent families within our society, and so forth. And as a matter of fact, participants not only shared some of the needs they perceived, but also some of the solutions. So one solution that was shared throughout the participant was to increase public awareness of disability and parenting. Going back to you, Marjorie.
Yes. So the second theme that that came out was to look at supportive public programs and policies that are already sort of in place. And one community partner quoted, "In the programs and services that the government develops, there is nothing specific for parents with disabilities. There are a lot of support services for parents who have children with disabilities." And of course, that community partner meant that there are a whole lot more in comparison, not necessarily making a judgment on the gaps of other services for parents who have children with disabilities. And this is very telling. And all the groups really mentioned this gap in public programs, in even mentioning parenting and policies. As a result, those groups suggested several solutions or potential solutions, one being to adjust existing services and programs, so not necessarily inventing a new one, but adjusting them, including funding and how funding is offered to parents. Because you can have some funding as a parent, you can have some funding as a person with a disability, but sometimes both don't sort of add up. You have to choose either one. But disability will add an added layer of need when you parent. The other solution that was brought forward was to recognize parenting within public policies. So to actually name it, to actually sort of make sure that people know that this exists, that they could, offer services to parents or to adults who now are wanting or desiring to have a family. And so that is important. The next slide. The next theme that came forward is to also continue to fund clinical programs that are very specific to parenting with a disability. And so one quote from a father who has an NMD said, "I still have access to rehabilitation services, but I mean, almost nothing is focused on parenting to help me. And then have all of the independence that I would like to have with the kids." So yeah, I would say, what services? I want to father entirely. I want to have my role. I want to be able to take part in the care of the children. And what this father mentioned also in the focus group is that it was important for him to be as involved as his spouse was. And so it was really sort of like not putting everything on the shoulder of the parent who doesn't have the physical disability, but being a very active part in the role of raising the children. All of these participants mentioned a few solutions to look at that, and definitely one of them was to provide a long-term continuum of care, which would include, in part, in-home parenting support, for example. How do we do this? How can we adapt the environment so that I am also capable, even though I'm in a wheelchair, or even though I have balance issues? And so really looking at that support in-house or in their environment. And then to also provide formal clinical training on parenting for professionals. Because we don't talk about it, because it's not sort of something that is seen, it's also not in the university programs or continued education programs. And the participants in the study sort of suggested that this would be helpful to have formal trainings so that their clinicians that work with them could benefit and help them out better.
So participants in our research shared a lack of social recognition, a lack of services for parents, and especially geared towards them, a discontinuity between different services, stigma, lack of knowledge about parenting, like you just said, Marjorie, in terms of continuing education, for example, or training for providers. And so this leads to the fourth theme, which was titled Parenting Supports Aligned with Child Development and Family Well-Being. For example, one spouse of a father with an NMD shared, when my husband was discharged from the hospital, I asked for psychological help for my children because my children had known a father who walked. But as they are preschoolers, what I was told was they will likely have very few memories as they get older of their father who walked before. But still, my daughter, you can tell that she has trauma from that. And in preschool age, there is no help. So this participant felt that there was a lack of supervision for both parents with disabilities and all of other family members, such as spouses or children involved. So basically, she felt that there was a lack of family support overall to help and support those families as they should be supported, and they're entitled to be supported along with their human rights. So in terms of solution, participants shared that we should align or better align child and parenting supports, and also perhaps develop new services and resources that are congruent with families' needs and whatever those needs are. Because I guess everyone knows in the audience that as children grow and develop, they may have different needs, and all of those will impact also parenting needs, of course. And finally, last but not least, our last theme, we titled it Barrier-Free Parenting in the Community. So here again, a community partner shared with us, all the gaps in physical or architectural accessibility are present when you are a parent. Finding a childcare center is one thing. When you add a wheelchair accessible criteria to it, then you need to start your search perhaps when you're in your 20s, like 5 years before pregnancy, to be able to find one. So here participants shared, and in numerous accounts, the physical inaccessibility of resources for parents and families, and also issues with adapted transit or paratransit, for example, to go out and about with their children in the community. So as a matter of fact, participants suggested that services and resources be physically accessible for parents and families, and that there should be some adjustments made in terms of paratransit services that are being offered to the disabled community in our society, to be able to access services with their children, of course. So we hope with those few key citations and solutions that we were able to draw kind of an overview of what are the main findings of our study, which now leads us to discussing advocacy.
Yes. So advocacy is definitely something that is needed and that has a purpose and a use in everyday society. But I can hear parents, thinking, I'm taking care of my child. I'm like doing everything. I'm tired at the end of the day. When do I have time to actually, on top of it, advocate? And that is a totally legitimate concern. And advocacy can be seen in many different ways. And I think that's where we wanted to represent here on this slide, is that advocacy can be done in those little actions that happens in our everyday life to something that's much bigger. It all depends on the level of energy that you have. If I take for myself, when Thomas was much younger, the 2-3-year-old stage, I certainly did not have much time to advocate for parents with disabilities as a general. But when I faced lack of accessibility, for example, in our common pool, community pool, then I would sort of mention it and I would say, look, you have to find another access. The access is only, through stairs. I need to find another way to get to the pool so that I could see my son for swimming lessons. And so together we found different ways. And that's where the advocacy in the small moments of the everyday life is sort of useful. There are other ways generally that we could do, like, for example, sharing with others. So making a complaint or talking to someone about making a place accessible, but also sharing with others that are like us, for example, that are parents with disabilities as well. We have this beautiful tool that sometimes is a curse, I agree, but a beautiful tool called social media, and there's different representation, and you'll see a bit later, different parents that are represented on social media, which allow to sort of build this thriving parenting community, where we share tricks and different ways of doing, but we also sort of represent the community of parents with disabilities. There's definitely, in terms of speaking up to our local or national associations, making sure that they are aware that parenting with a disability do exist. A little bit like today, we were invited by Dystrophy Canada, and it's important because it's important to have those conversations and to make known that parenting with a disability does exist, and there are gaps, and that we are trying to mend those gaps. We can also ask for support, but in a way that is very normalized. Every parent needs support, especially when you hit, actually, I would say every stage of development of a child, there's new challenges. So there's new opportunities to ask for help, 100%. And so asking for help is not necessarily asking for help in formal services. It could be also in your own community or in your own family. And that is also one way to advocate, to be able to sort of say, I need like somebody to come with me in the pool, for example, because I want to be part of the swimming lessons of my child, but it's safer if another adult is there for my child. And so asking that support and asking and negotiating that support is very important. And then the last one we wanted to focus on is to participate in research. You've heard us mention that we have limited numbers that speak to the reality of parents with disabilities. And so participating in research allows us to collect as a community, as a society, those numbers, those lived experiences to hopefully affect change in services.
Thank you, Marjorie. And so if today's presentation was of interest to you and you're a mother with a disability and you wonder how you can participate in the research, well, here is one example, and there are many other opportunities. You could perhaps look into that with your association, including MDC, which has been a great partner of ours in numerous studies, actually. So here's one opportunity. So this work is led by Dr. Hilary Brown, who has her research laboratory at the University of Toronto Scarborough. And in just about a few weeks, we will be conducting some interviews with moms with a disability in terms of better understanding how they are able to access pediatric care, so child care for their children. So are there any, for example, challenges in terms of accessing pediatric services when a mom has a disability? Are there any facilitators that make that access easy, and so on? So if that isn't of interest, you can see on the slide the contact email of Dr. Brown, and you see that this work has been, we have ethics approval to conduct this research work and numerous partners involved, including MDC. So we thank them really for that. And so we're now stepping in the last segment of our webinar and our last question that we hope to answer. What resources are available to support parents with an NMD? So for example, you should look into your local and national association, including MDC, but also perhaps other disability or disability rights associations within your provinces or regions. That could be a first idea. There's also some organizations such as, for example, Tetra Society of North America or the program Designability by March of Dimes Canada. So they have a few chapters, if not chapters, in all the Canadian provinces. And they're able to pair volunteers into creating custom adaptations. And we know that in some cases, parents have been in contact, for example, with those societies or programs, and they were able to access, for example, accessible cribs that help them to better parent and parent safely, of course, all the while meeting their child needs, but also their own needs as a parent. There are also some programs that are specific to some provinces. So for example, in Ontario, perhaps you have heard at the Sunnybrook Healthcare Science Center, we have the Accessible Care Pregnancy Clinic, which is really focused on people with a physical disability that are pregnant, and all their staff has been trained to provide care respecting the best guidelines that we mentioned earlier in the webinar. You may have heard also of, for example, the Center for Independent Living in Toronto and their Parenting with a Disability Network. They hold numerous conversations, activities between parents. They also have a Facebook page where parents may share, for example. So you should look into that if you're based in Toronto or Ontario, should I say. And there are also new resources that have been recently created. I have in mind, for example, the Provincial Council for Maternal and Child Health. So they have recently created disability and pregnancy resources for health administrators, clinicians, and parents living with disabilities. So you should be able to access all of those resources online. And these were actually produced also by Dr. Brown's team and collaborators. And Another example which came to mind is based in Quebec. So in Quebec, there is the Parents Plus Clinic, which is an occupational therapy-based clinic exclusively for parents living with a physical disability. And they provide care and support to parents up to the 2 years of age of their children. And they also have created throughout the last 25 years or even more actually since they're in service, customized solutions to facilitate everyday parenting in using, for example, adaptive parenting equipment, which may be really hard to find on the market otherwise. We also made a list of few reading suggestions if this topic is of interest, if you would like to learn more about it, if you would like to have various representations of parents living with disabilities. So these are books we have read and really enjoyed. I highlight the second one, which was authored by Marjorie, which I had the pleasure of reading, and I think it was absolutely amazing. So I do encourage you reading it. And there's also a book that will be out in just about few weeks. There's already an Australian version, but now I believe there will be an American version of that same essay called We've Got This. And here you will be able to read or hear the stories of many parents with disabilities. So kind of in response of the lack of representation of parents with disabilities in our society, these suggestions could be of interest to you. We also have some podcast suggestions. The first one actually is hosted by Marjorie. It's called Parenting Done Differently. There's another one called Disability Maternity Matters. Another one, We've Got This. And in kind of honoring the recent passage of Judith Humans, who was an absolute great and important disability rights advocate in the United States, but also throughout the world. We wanted to acknowledge that within her podcast, she had an episode on parenting and mentoring with a disability that could also be of interest to today's community. And finally, to our knowledge, there are 2 great TED Talks. One already available, which was given by Dr. Kara Ayers, entitled Disability Parenting in an Ableist World, and one that is forthcoming, given by Marjorie, and we're really excited once it will be launched to have the opportunity for everyone to hear her important thoughts on why parents with disabilities know more about parenting than experts do. So thank you for that, Marjorie.
Thank you. We also wanted to share with you some groups that you can find on social media. Here is a list, and for sure you can just have a look. Some of them have quadriplegia or paraplegia, others different physical disabilities. There are some moms, there are some dads, there are some families that are represented in those groups. To focus on maybe on this list, the Disabled Parenting Project, that you could get some ideas in terms of ways to do things, equipment, and so forth. The Adaptive Parenting Project is also sort of focused on that, as it is a nonprofit organization that's really dedicated to empowering parents with disabilities. And then you have Disability Maternity Care that is also very active on social media. You can, next slide, yes. This one is one of my favorite slides. You may or may not be a fan of America's Got Talent, but just recently, a few weeks ago, one dad who has cerebral palsy had a fantastic, he's a comedian, and just made a fantastic speech on parenting and what it looks like when you have cerebral palsy. And it's fantastic because it really focused on how people perception of parenting And he gave it a twist, a humoristic twist. And so it's so much more about sort of how people react to parenting from parents who have a disability than it is about sort of laughing at himself. So you should check it out. There are others that use humor to represent and to also sort of maybe change perceptions as they are doing it. Sometimes it's sort of, you know, some messages passes better when there's humor in it. So with that said, Evelina and myself would like to thank you for being here, for listening, for talking about it, for having an interest on parenting with a disability. Here are our contact information. And what you can also find in the PowerPoint are the references of the work that we've used throughout the presentation today. We have a few more minutes, I believe, for questions, and we are looking forward to those.
Thank you both so much for a very clear presentation, really engaging. I'm seeing a lot of positive comments that are coming through to me. What I would like to mention is the first comment tonight, and I believe you mentioned this during the webinar, but as a father affected by neuromuscular condition, he is mentioning that it is disappointing sometimes to see that much of the literature and studies focuses on motherhood, while that we know that that is an area that still needs work as well, that fathers with the disability are less studied, specifically those with neuromuscular conditions.
Yes. This is actually something that Evelina, myself, and a group of our colleagues are trying to remedy too. So we've just made, you know, a grant. We submitted for a grant to be able to focus on fatherhood because there is a lack. We've known this for many years. It's been recognized in the field of parenting with disabilities. Sometimes it's easier when we recruit to find mothers because we're looking at pregnancy, so it's sort of easier to look at those services. But we're definitely making an effort and trying to add to the literature to focus on fathers. But you're totally right, and it needs to change.
Another question that I'm seeing is in terms of some neuromuscular conditions can be hereditary in nature. And when this mother is speaking about having a neuromuscular condition that then her child also has, there is value in having the shared experience, but also there is some psychological impact, seeing how the disease impacts their child differently than themselves and how opportunities are different for their child than themselves, which could potentially impact maternal-child relationships is what they're speaking about. Do you all have information on that?
Evelina, do you have, because I don't, there's not research that comes to mind on my end in terms of that particular. I could only share in terms of lived experience where, you know, at the beginning when I was mentioning the research, this is definitely a legitimate concern, but also sort of the benefit, like this father is mentioning, has been reported by parents as well, in terms of knowing that I can sort of show my kid how to navigate life with a similar condition. But definitely there is the need to access psychological supports and help in terms of navigating what is different and what, you know, the impact it has and sort of how to overcome those challenges that are more difficult in a way. But that's a gap in not only research, but clinical practice.
And like you said previously, Marjorie, in our slides, sometimes it's more not only a case of having a disease or a condition or a particular disability, but also how a family adjusts and faces the challenges, such as the lack of accessibility of services or the gaps in services, and how that actually has a huge impact on families' lives. So it's sometimes really much more at a macro level than actually at an individual level, right? So, and yes, just to add to what you shared, to my knowledge, I can think of research where we explored both the lived experiences of parents and children altogether that had a disability, although in our study sample, some parents had also children who had related or unrelated certain healthcare conditions or disabilities. So sometimes, yes, there may be a genetic component, but sometimes it's not related to the parent's disability at all, and children have their own needs as well. So we did not focus on that aspect within our research, but we had some participants that, yes, children were also having a lived experience of disability.
Wonderful. Another comment, the video that you showed really resonated with many of the viewers here today. One mentioned that particularly talking about physicians' perspectives on what they need in terms of wellness checks and in terms of annual checks resonated and fell with her experience. But the other piece that she mentioned was building awareness not only with physicians, but sometimes other healthcare specialists. So they shared with me an anecdote of a personal story whereby a lactation specialist, was really actually was there to support their breastfeeding needs, but instead they felt like the whole consultation was more so around bottle feeding. And the premise wasn't because the child was not able to take the breast, but that they felt like they were, because of their disability, they were strongly encouraged to bottle feed. And so they were saying, really, they were hoping MDC, along with researchers like yourself, can help to build awareness for non-medical specialists like those who are in lactation.
Absolutely. And if I can just maybe share quickly about it. So as a postdoc fellow at the University of Toronto Scarborough, one of my main projects will actually be to investigate healthcare providers' knowledge and training needs. So that will include, yes, physicians, but it will include any other pregnancy care related providers, so nurses, lactation consultants. So really thank you to that person who commented. And also we have a project related to breastfeeding as well, and how to better support breastfeeding practices and supports for parents with physical disabilities. So yes, this is definitely an area of both clinical care need and again, research needs. So yes, absolutely. Thank you for that.
Wonderful. Well, thank you both so much for your time. I do see one other question, which is around French resources. You mentioned some really helpful English resources that we'll definitely be sharing with our clients, but questions around podcasts or books that you would recommend. So maybe I can send that to you by email and then share it with our manager of programs and services, Veronique, who can help share that information with clients as well. So.
Absolutely. And I can just share that Marjorie's book was also translated in French. So here's one quick resource that you can easily access in terms of reading, for example.
Beautiful. Well, thank you again for your time today and a really clear, well-delivered presentation. And we welcome if anyone has any further questions about this or is looking for supports or accommodations, or even someone to speak to please contact us at research@muscle.ca, and we'd be happy to support your advocacy and your needs. Thank you all so much and have a good rest of your day.
Thank you.
Thank you.